Hi everybody, Beth here from Access Paranormal. For this week's I Want to Know, apologies for being a little bit on the late side. This new job is a little bit more hectic and a little bit more travelling at the moment, so hence the reason why it's taken a little bit for me to rush through the door and do this. And obviously be able to talk about this particular topic for this week, which is about taking on possible demonic cases. Now, this one is pretty, as we know, it's the D word, and the D word brings out a lot of emotions for people, and a lot of teams will have over the years, and sometimes still do now, will actually contact me saying, look, I think I might actually have a possible demonic case to deal with. You know, it's too full on, it's too much for my team. Can we forward it on, sort of thing, or do you know someone else you can sort of get involved with it, because we think it's out of our hands. And I think it's really good that you know yourself and where your limits are, especially as a paranormal investigator. It's D time. Let's go deep. That's right, Glenn. Hope you're doing well, mate. Oh, Mel, I thought I'd missed it again. No, it's okay, sweetie. I was late. Oh, hi, Adam. Good to see you, lovely one. So, yes, it's an interesting, as the D word. All right, so firstly, a couple of things to think about when it comes to something like this particular topic. There were some fabulous responses that people had posted. Again, I always love those. I always love finding out Nate's responses, being a very proud Satanist. So often when it's a demonic topic, I know I'm going to get a comment from him, and I love it anyway, because definitely he knows that side of spirituality, I guess you could say it, from his perspective, and I'm always open to hearing about that as well. And I think I implore anyone to have a chat with somebody who does follow Satanism in its true form, I guess you could say, just as a learning thing, you know, as well. But also if there's something you want to do, that's fine too. So yeah, always have a Satanist on your side. Your enemies. No, I'm joking. So jokes aside, this is a pretty intense topic. So first thing I would mention is what constitutes demonic possession. So I know that Anne had said, well, she want to know, like, if someone thinks, you know, if you get a query and someone says, I think there's something demonic in my home, it's really intense, it's very negative, it's this, it's that. Okay, it may feel like that for something. Not to say we doubt every person that contacts us, but I think it's important to to have a really good idea of what could possibly be demonic. Now, again, we're talking possibly, you know, there's possibility of hauntings with, you know, ghosts and spirits and things like that have not been proven per yet, but there is something going on. People are experiencing stuff. So we're talking at the possibility, well, if that did exist, what will we do? So with that being the case, I would say with demonic possession, you'd really need to have a really strict criteria as to what would actually be ascertained as that. So a person may be feeling they're experiencing it. They may be, we don't know. Hollywood has a lot to answer for, I tell you that. And that could exacerbate the situation. That could actually make them feel that it could be demonic. So the first thing is is it a proper demonic case or not? That's the first thing I would say, you know, and you should also have this type of criteria for even haunting cases. You know, someone says, I feel like there's a spirit in my home, I'm being watched, I'm being this. They may very well have, but you don't know that yet. So what criteria do you have to be able to help them out with that, you know, with your interviewing process or anything like that? So that's the first thing. Is it actually a possible demonic case that you could actually be taking on? Second one is also if you feel confident to do so. Do you have enough knowledge? Do you have enough experience? You know, have you studied it? Is there somebody on your team that studied it? It's, you know, what do you look at demonic possession as? You know, is it something you can help with at all? Do you have contacts as well? So if it is something that you want to move through, is it something your team wants to do? Is it, you know, do you have contacts with the church? You know, if it's that type of demonic possession, you know, there are many different types of demonic possession. When I say types, different faiths also have their versions of it as well. So do you then have access to that kind of knowledge too? Because it may not necessarily be from a Catholic or Christian faith as well. Evening, Blair, how are you, lovely one? Hey, Bob, good to see you, lovely. So it could be either one of those things as well. It's not just something that could be just one-sided. And it's also, again, it's having the knowledge for this. And if you've got access to that knowledge, if your team doesn't quite have that, you know, are you confident enough to want to take it on? Because I think there is a certain level of severity, whether or not it's demonic, because a person's acting in a very extreme way or is experiencing something quite extreme. So do you feel confident as a team, and an investigator, or really it should be both, whether or not you want to proceed? And also, is everybody in your team happy with something like this? Not say happy as in, oh yeah, it's demonic, but more the fact of, are you happy or comfortable and confident enough, everybody in the team? I think it's really important that everybody it comes to the same agreement with something like this, because it is a whole level of seriousness. Whether you believe in demons or not, it's still a level of seriousness that needs to be considered as well. Oh, hi Jen and Jen. Good to see you here, lovely ladies. Sort of see you here. I never get used to saying that properly, or the meaning behind it. Good old internet land. So there's that too. Also, is the person that is has come to you with this possible case, are they willing to listen to reasonable explanations, which I call your PAE, your possible alternative explanations, more commonly known as debunking. And of course, people have known me for a while, know the reasons why I term it differently. But are the people that you're dealing with, or possibly looking at dealing with, quite open to having things explained? Maybe there are ways you can actually explain some really heavy, difficult experiences with things that could be naturally happening. So that to me is a very, very important thing to bring with any case, not just possible demonic ones as well. I'm here. Hi Karen, good to see you, lovely one. So yeah, there are other things to keep in mind as well. Is the client, how long has it been happening for? I think that's an interesting aspect to keep in mind too, because just like with haunting cases, again, not every person that's going to come to you is going to, sort of be making it up or full of crap, if you want to call it that way. A load of baloney, as our Judge Judy says. Maybe people are experiencing something, but maybe it's not as difficult or as severe, or there could be other explanations. So, how long has it been happening for? There are people that do want to believe more that it could be something negative like that, and it's full on, and there's scratches and things like that. There was a case I was dealing with, gosh, probably about 2.5 years ago, that I came across, and she said it was quite intense. She was getting scratches for quite a while, all different reasons as to why she thought this might have happened. Originally, she had a mother pass, and she was in a state of grief, then started to try and make contact with her through audio recording devices, because that's what she sees on TV. So I guess, it's the 50-50 with the greatness of having TV shows. They promote the fact that there's an interest in this, but also then everyone thinks they can go and do this. Maybe they can, I don't know. But she believed that was something, she was calling something else that was not her mother to her. And that's what she felt was going on. Take it on board, make a note of it. As I said, it's empirical evidence, so it's personal, it's inside information. So be really careful with that as well. You're dealing with other people's experience, again, just like with hauntings. If it's for this particular woman, it's been happening for about almost a year. That sometimes you'll find people will want to shop around for paranormal investigators to validate what they believe is going on, when it may not be what they think it is. So that's another thing to be wary. Again, a really good screening of your interviewing process will help with that. You can't always weed them out. Sometimes they can be really good, but having a bit of an indication as to how long the case, the person's actually been dealing with this, what they believe is this type of phenomena, will be a really big indicator. I've had someone who approached me and said, look, I've had stuff happening to me for the last 10 years. I just want it to stop. And I'm thinking, all the people they would have approached, they would have found some sort of solution by now. So I often ask, well, okay, so look, have you seen any other investigators? Have you contacted the clergy, or whatever faith that person's in? What steps have you done to help fix this situation? Because if someone's going through that for 10 years, they're Superman, if it's what it actually is. So yeah, be really careful if it's been happening for a very, very long time. I tend to usually avoid those particular cases. If they believe it's been happening for maybe around 6 months, maybe a couple of months, I'm still even unsure of that, because if it's true demonic infestation, it does take over time, but it's repeatable. as we know, so hauntings. So I would probably, you know, if it's a couple of days, well, yeah, look, you know, make notes of what's happening. You know, if you're feeling really unsafe, you know, find ways to empower yourself in your home. You know, the things that we often do as investigators to help people through these particular situations. So there's a couple of things to think about there. It's really up to the team, really up to the confidence you have in dealing with intense experiences, because that's what it is, whether it's demonic, whether it's not. And move from there. And I think it's good to have a joint exclusive sort of team agreement with the fact that you're going to move forward in that way as well, so that everybody's on board, whether it's, yep, we are totally ready for this, we've got information, we've got access to resources that we need, great, let's move ahead, or say, look, you know, we'll never take them on, but also at the same time there will be people that will approach you, and just like with me, I've got people that I know that I can refer these cases to, that I've worked with over the years. So yeah, keep that in mind if that's something you really want to do. Again, use the comment section down below. Love to know your thoughts. You know, have you dealt with a possible demonic case? Is it something you kind of wanted to do? You know, you're ready for a different level of investigating, because it's like private cases on steroids. So you've really got to think about it, whether or not it's something that you want to do. And it takes a lot of, again, already what we do takes a lot of dedication, because it is generally a free service that we provide in fitting around our own time. So have a big think about that as well. Yeah, see you in a few days, Mel. So yes, do take care, everybody. Use the comment section. Love to know your thoughts. Thank you so much for being patient for my slight tardiness, and I will see you. Actually, I may not be able to next week, but I will confirm either way. Mwah. Take care, everybody.